So my main research area is stroke research, mainly looking at particularly at what we call acute therapy. It's emergency urgent therapy to help stroke patients to improve the outcome. Mainly looking at open up the blood vessels to let the blood flow back to the area being damaged by the stroke. It's bringing the research from bench science into patient care. So what we call translational is translating what's a bench into medical care and hopefully impact patients' life and improve the outcome.
Most of that involves in what are the patterns of stroke on a brain scan, and by judging where the patterns are of the stroke, we can work out what's caused the stroke, thereby hopefully preventing a second stroke and guiding how we treat future patients. So what fascinates me is that the human brain is so resilient. You will see a stroke in one part of the brain, yet you will see patients recover, whereas other patients won't. And so that's what drives me. What is it? What is the process? What causes the disability? How can we prevent it? And even if there is a disability, how can we improve it?
So we do research that's around things like acute treatments for acute stroke patients. And we also trial novel therapies that may help those patients day to day. We enrol patients during our clinical work to be able to enhance that research, where we're working together with our medical colleagues, our nursing colleagues, our allied health colleagues, and right across the organisation.
We're probably one of the biggest stroke unit in terms of catchment area and patient. So there's a lot of data pool there. One particular interest at the moment, we are looking to collaborate with engineer department at Monash University to see how we can bring in robotics to help with stroke care. In particular, there's a group of patients who has a lot of delirium post-stroke, which just means that they're very confused and they require a lot of sedation and medication. So we're trying new things here, and that's what I like about Monash, very innovative, new collaboration with new ideas.
We've managed to bring together two departments, so Department of Neurology and Department of Emergency Medicine. It's just amazing to see the teamwork and collaboration that you can generate just when you start talking about why you're doing things and getting other people to join in and help you to figure out a global problem together.
Our ethos in how we manage patients, every patient is precious. We will do our best for the patients. We will get up in the middle of the night and we will think about it and we will be there holding their hands. And I think the research drives us so that we can be the best doctors that we can be.
When I first came to Monash, the most striking thing is how close the team is. And we work together in a lot of things. We have coffee over regularly, and that's where our ideas comes. We see patients say, "Hey, what's the problem? Could this be something that we might be looking at?" And I think the way research, the best research, I always believe it comes from that, from a clinical question,
and generating new knowledge and pushing science forward. I think that's what you should be proud of as a person who does research. You're generating new knowledge for other people.
Well, one thing I'm particularly most proud of my research is what we call extending thrombolysis time windows. Previously, when thrombolysis, what we call clot busting medications, only limits up to 4 hours from stroke onset, which are very, very tiny time windows. Only a few patients could able to get to hospital quick enough to get this therapy. However, through my research and collaboration with people nationally, internationally, we were able to extend the thrombolysis time window up to 9 hours, and also in patients with wake-up strokes.
With regards to the research that I've been involved with, I'm particularly proud of the work that's been done in the endovascular clot retrieval and reperfusion space when it comes to acute stroke management. At Monash Health here, we've been involved in a number of national and international trials, and we've seen those upfront therapies make a huge difference to our patients. We're seeing patients who in the past may have been very functionally impaired, ended up having major changes occur in their life, to be able to leave hospital just within a few days and return to normal or near normal function. And that's been really, really fantastic to see. We love those outcomes for as many patients as we possibly can.
In terms of research, it's so wonderful talking to people who are excited about the things that I'm excited about. What can we do? How can we make things better? What questions can we answer? So I've got to say, it's a wonderful experience. It's always a joy waking up and coming to work.
I think that we also are all very supportive of each other, which I really enjoy day to day.
And it's just awe-inspiring and humbling to see that a lot of the stroke history was actually written under our roof. That Monash Health were the leaders for so many different aspects of stroke care.
And the direct location make us able to work at both research centre and also clinical centre at the same time and make a seamless transitions of our research ideas to our patient care.